February is Heart Health Month. According to the Centers for Disease Control, 1 in 3 adults, that's more than 80 million people, have some form of cardiovascular disease. This year alone, heart disease will cost more than $316 billion. CBS 4's Cynthia Demas shows us the risk factors so you can better manage and even prevent heart disease.
44-year-old Greg Martin of Fort Lauderdale learned in college that he had cardiovascular disease.
Growing up, we knew that cholesterol was an issue in our family.
Knowing his risk factors has allowed Martin to manage his condition and remain physically active.
We always have to keep an eye on my diet and weight, and I try to exercise. I still play basketball at least once a week with a bunch of buddies.
According to the American Heart Association, the major risk factors of heart disease cannot be changed. They are your family history, your sex, men are at higher risk, and increasing age. More than 83% of people who die of coronary artery disease are 65 or older. Cardiologist Charles Russo with Holy Cross Hospital says there are some factors we can control.
The reversible ones are the ones that we can control are things like smoking, diabetes, knowing what your cholesterol is, both good and bad, knowing what your blood pressure is, what your weight is, and whether or not you're exercising.
Other contributing factors include stress and drinking too much alcohol. Dr. Russo says oftentimes there are no warning signs, but symptoms you should not ignore are anxiety, shortness of breath, dizziness, and chest pain, also known as angina.
The classic angina is a pressure or tightness or heaviness in your chest, or you feel like there's a band across your chest, or the classic, an elephant sitting on my chest.
Martin takes several medications to keep his cholesterol down, but warns regular checkups are essential to managing any heart condition.
You really have to come in and get checked and get assistance from the doctors, because diet would not have taken care of this for me.
Pain radiating down the left arm or pain in the shoulders and the neck and jaw are also signs you do not want to ignore. To improve blood flow to the heart, medications can help. In more severe cases, patients may need a stent to open up an artery or even bypass surgery. Consult with your doctor, that is for sure. For your health, I'm Cynthia Demas, CBS 4 News.